Question 1. Given the circumstances Dr. Hernandez is overseeing, a facility that uses both reactor-produced and accelerator-produced isotopes for therapeutic procedures, a new shipment of iodine-131 has arrived and a junior technician mistakenly stores it in the same shielded container used for fluorine-18. Dr. Hernandez is alerted to the misplacement. What is the most appropriate immediate response to this incident from a radiation safety standpoint? A. Leave the isotopes together since both are used in medical applications. B. Instruct the technician to move the iodine-131 only after consulting with the radiopharmacy supervisor. C. Remove and properly segregate the isotopes immediately according to their origin and energy characteristics. D. Conduct a detailed radiation survey before making any changes to isotope storage. Answer. Correct answer. C. Explanation. Reactor-produced isotopes e.g. R131 and accelerator-produced isotopes e.g. F18 differ significantly in their half-lives, radiation energies, and shielding requirements. I-131 emits high-energy beta and gamma radiation, while F18 primarily emits positrons leading to annihilation photons. Placing them together without proper consideration of shielding and decay characteristics violates HALARA and NRC TFR Part 20.1801 on secure and segregated storage. Although a radiation survey is important, immediate segregation is prioritized for unintended exposure or contamination. Question 2. The relationship between the decay constant L and half-life T12 radionuclide is essential in calculating safe storage durations. Which formula correctly expresses this relationship? A. U equals Ln 2. B. T equals Ln 2. C. T typically NUL. E. L equals 1 equals X Ln 2. Answer. Correct answer. C. Explanation. The decay constant L is related to the half-life by the equation E equal Ln 2 L fundamental relationship in radioactivity. This expression comes from solving the first-order differential decay equation. Misunderstanding this can lead to incorrect decay time estimations impacting waste management and shielding design. This is also critical when complying with NRC decommissioning regulations and ALA principle during material storage. Question 3. As demonstrated by recent compliance inspections, one facility was penalized for failing to maintain real-time radiation detection during maintenance inside a high-energy X-ray room. Which detector is best suited for continuous monitoring of radiation exposure in real time under such conditions? A. Thermoluminescent dosimeter TLD. B. Solid-state diode dosimeter. C. Ionization chamber survey meter. D. Film badge. Answer. Correct answer. B. Explanation. Solid-state diode dosimeters offer real-time radiation monitoring, which is essential in high radiation areas or during maintenance. TLDS and film badges are passive devices and require later analysis. Ion chambers are survey tools, but not personal wearable monitors. According to ANSI NN.11 and 10 CFR Part 20.1502, individuals working in radiation areas must be equipped with suitable responsive dosimetry for real-time dose awareness. Question 4. In light of recent developments, Ms. Patel, a radiation safety officer, is revising emergency protocols for a cyclotron facility. She must include provisions for a worst-case spill involving a gaseous radioactive effluent. Which actions should be prioritized in the emergency plan? A. Shut down HVAC and initiate containment procedures. B. Direct all staff to evacuate the building immediately. C. Increase airflow to dilute the radioactive gas. D. Spray water mist to reduce airborne radioactivity. Answer. Correct answer. A. Explanation. In gaseous release scenarios, such as from a cyclotron, containment is key. Shutting down HVAC systems and sealing off ventilation prevents spread of radioactive material, aligning with NRP Report Note 147 and IA Safety Standards GSR2 on emergency preparedness. Evacuation is important but must be preceded by containment actions. Increasing airflow contradicts ALARA. Containment protocols. Question 5. Among the various radiation effects, which of the following is considered deterministic rather than stochastic? A. Leukemia. B. Skin erythema. C. Thyroid cancer. D. Genetic mutations. Answer. Correct answer. B. Explanation. Deterministic effects, also known as tissue reactions like skin erythema, occur above. The threshold dose and severity increases, with dose unlike stochastic effects, e.g. cancer genetic mutations, which are probabilistic and follow the linear, no-threshold LNT model. This distinction is foundational in risk assessment and is emphasized in ICA Publication 103 and NRC Guidance, Occupational Exposure Limits. Question 6. To illustrate this point is Salazar is handling a sealed CS-137 source used in industrial gauging. During a routine survey, elevated readings are observed near a sealed junction. He suspects a potential leak. Which protocol should he follow immediately? A. Decontaminate the area using standard surface cleaners. B. Transfer the source to a fume hood for observation. C. Perform a wipe test and assess removable contamination. D. Assume it's equipment error and recalibrate the instrument. Answer. Correct answer. C. Explanation. The appropriate action is to conduct a wipe test per 10 CFR 35.67 and ANSI N.6 to determine if there is removable contamination indicating a sealed source leak, decontamination, or equipment relocation is premature. Assuming error without verification risks non-compliance. The leak test must quantify contamination levels and determine if regulatory reporting thresholds are exceeded. Question 7. Based on the information, which radiation matter interaction is most significant in tissues when dealing with low-energy photons, e.g. 30 keV, A. Bremsstrahlung radiation, B. Compton scattering, C. Pair production, D. Photoelectric effect. Answer. Correct answer. D. Explanation. The photoelectric effect dominates at low photon energies, especially in materials with high atomic numbers Z, such as bone or lead. It is highly energy and Z-dependent. Compton scattering dominates at medium energies, 100 keV 10 MeV, and pair production requires 1.2 MeV. Understanding this guides protective material choice and risk estimation per ICA Publication 116 in NRP Report No. 160. Question 8. In comparison with other shielding materials, which of the following is most effective for shielding beta particles from SR90 sources used in radio tracers? A. Lead sheets. B. Acrylic, plastic. C. Tungsten bricks. D. Concrete blocks. Answer. Correct answer. B. Explanation. Acrylic or plastic are best for beta shielding to minimize Bremsstrahlung production, which occurs when high-energy betas interact with high-Z materials like lead. This principle is fundamental in NRC Regulatory Guide 8.18 and EATech Duc 1162. Acrylic slows down beta particles without creating excess secondary radiation, a critical consideration in lab safety design. Question 9. Throughout the course of implementing a training program, the RO notices that new radiation workers do not recall location-specific emergency procedures. Which of the following strategies aligns best with regulatory training requirements? A. Require workers to pass a national radiation safety exam. B. Provide training only once at time of hire and document it. C. Conduct regular refresher trainings and site-specific drills. D. Post safety posters near radiation rooms and monitor comprehension. Answer. Correct answer. C. Explanation. According to 10 CFR 19.12 and IA Safety Guide RAG 1.4, site-specific and ongoing radiation safety training is mandatory, especially when procedures change. Drills reinforce behavioral response and familiarity with emergency actions. Merely testing or posting signage does not meet regulatory standards or behavioral competence criteria. Question 10. The impact of linear energy transfer on biological tissues is critical in radiation protection. Which combination below correctly reflects high LET radiation and its biological impact? A. Alpha particles, low biological impact due to short range. B. Beta particles, high LET and high biological impact. C. Gamma rays, low LET and low biological impact. D. Neutrons, the high LET and high relative biological effectiveness. Or B. Answer. Correct answer. D. Explanation. Neutrons and alpha particles are high LET radiations. causing dense ionizations over short paths leading to increased biological damage and higher RBE. While alpha particles have short ranges, their internal exposure is dangerous. Gamma rays are low-let, less damaging per unit dose. Regulatory implications include weighting factors, WR, used in effective dose calculations per ICOP 103. Question 11. Given the circumstances, a researcher is performing an experiment involving a radioactive isotope with a half-life of 5 hours. If the initial activity of the isotope is 1000 BQ, what will the activity be after 15 hours? A. 500 BU, B. 125 BU, C. 250 BU, D. 750 BU. Answer. Correct answer, B. 125 BQ. Explanation. The activity of a radioactive substance decays according to its half-life. The formula for decays equals A0x12 TT12 A0x21 T12 where A is the final activity, A00 is the initial activity, TT is the time elapsed, and T12 T12 is the half-life. After 15 hours, which is 3 half-lives, the activity will have decayed by factor of 2 3 equals 8238. Therefore, the activity will be 10 BQ 8 equals 125 BQ 1000 K1025 BQ. Question 12. In the context of radiation protection, NARIO must ensure that shielding is used effectively. What is the primary factor influencing the effectiveness of shielding material? A. The thickness of the shielding. B. The cost of the material. C. The material's atomic number. D. The type of radiation involved. Answer. Correct answer, D. The type of radiation involved. Explanation. The type of radiation plays a significant role in determining which shielding material is effective. For example, alpha particles can be stopped by a sheet of paper, while gamma rays require dense materials like lead or concrete. The material's atomic number can influence its ability to interact with certain types of radiation, but the type of radiation itself is the primary factor in shielding design. Question 13. Under the assumption that an RO is evaluating the risk of radiation exposure in a medical facility, which of the following is a key consideration when calculating the potential dose from a diagnostic X-ray procedure? A. The patient's age. B. The distance from the radiation source. C. The number of radiographic images taken. D. All of the above. Answer. Correct answer, D. All of the above. Explanation. When evaluating radiation exposure, several factors need to be considered. The patient's age influences their biological sensitivity to radiation. The distance from the radiation source affects the dose received due to the inverse square law, which states that intensity decreases with the square of the distance. The number of radiographs taken directly impacts the cumulative dose. Question 14. Taking into account the principles of radiation protection, which of the following best describes the use of time, distance, and shielding to reduce radiation exposure? A. Reducing exposure time, increasing distance from the source, and using thicker shielding are the most effective methods. B. Increasing exposure time, decreasing distance from the source, and using thinner shielding are the most effective methods. C. Reducing exposure time, reducing distance from the source, and avoiding shielding provide the best protection. D. Increasing exposure time, increasing distance from the source, and using more shielding has no effect. Answer. Correct answer, A. Reducing exposure time, increasing distance from the source, and using thicker shielding are the most effective methods. Explanation. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure. The most effective method is to reduce the time spent near the radiation source, maximize the distance from it, and apply appropriate shielding. These measures, based on radiation protection principles, reduce both the and potential harm to personnel. Question 15. From the perspective of regulatory requirements, which of the following statements is true regarding the storage of radioactive materials? A. Radioactive materials must be stored in a locked, shielded container with appropriate labeling and ventilation. B. Radioactive materials can be stored in any location within the facility. C. Only a specific class of radioactive materials needs to be stored in a licensed facility. D. Radioactive materials should be stored in open areas for easy access. Answer. Correct answer. A. Radioactive materials must be stored in a locked, shielded container with appropriate labeling and ventilation. Explanation. Regulations, such as those from the NRC Nuclear Regulatory Commission and IAEA, International Atomic Energy Agency, require that radioactive materials be stored securely in a manner that prevents unauthorized access. This includes using locked, shielded containers and ensuring adequate ventilation prevent the buildup of hazardous gases. Question 16. In light of recent developments, NARAO is conducting a survey of a radiological facility. Which of the following is the best approach to ensuring the accuracy of radiation survey results? A. Using only one type of radiation detection instrument. B. Calibration of radiation detection instruments before use. C. Conducting surveys at irregular intervals. D. Relying solely on personal monitoring badges for assessment. Answer. Correct answer. B. Calibration of radiation detection instruments before use. Explanation. To ensure accurate radiation survey results, it is critical to calibrate detection instruments before each use. Calibration ensures that the instruments provide accurate readings in accordance with their specifications. Relying on a single type of detector or using personal monitoring badges alone does not provide a comprehensive assessment of the radiation environment. Question 17. What would happen if an RSO failed to properly monitor radiation exposure levels in a high-risk area? A. The facility would remain in compliance with regulatory requirements. B. Workers would be at risk of exceeding their dose limits, leading to potential health consequences. C. The exposure would automatically decrease without intervention. D. The radiation safety program would function more effectively due to less monitoring. Answer. Correct answer. B. Workers would be at risk of exceeding their dose limits, leading to potential health consequences. Explanation. Failure to monitor radiation exposure in high-risk areas can lead to workers exceeding occupational dose limits, which increases the risk of radiation-induced health effects. Regular monitoring and adherence to dose limits are essential components of a radiation safety program to protect personnel and ensure compliance regulations. Question 18. What factors contribute to the biological effectiveness of radiation exposure? A. Linear energy transfer, radiation type, and dose rate. B. The type of shielding used in the exposure time. C. Only the total dose and exposure time. D. The temperature of the environment and the type of radiation source. Answer. Correct answer. A. Linear energy transfer, radiation type, and dose rate. Explanation. Biological effectiveness is influenced by factors such as the type of radiation, alpha, beta, gamma, the linear energy transfer, and the dose rate. The high radiation, like alpha particles, is more biologically damaging than low radiation, like gamma rays, and high dose rates can cause more significant cellular damage. Dose and exposure time. Also important, but and radiation type are critical. Question 19. As demonstrated by recent studies on radiation protection, which of the following is the primary method for reducing radiation exposure in fluoroscopy procedures? A. Increasing the exposure time. B. Using lead aprons only for shielding. C. Maintaining a safe distance from the radiation source. D. Using low-dose techniques and minimizing fluoroscopy time. Answer. Correct answer. D. Using low-dose techniques and minimizing fluoroscopy time. Explanation. In fluoroscopy, minimizing exposure time and using low-dose settings are key to reducing radiation exposure. It is important to minimize fluoroscopy time while ensuring that the diagnostic quality of the image is not compromised. Lead aprons offer additional protection but do not replace the need for time and dose optimization. Question 20. Considering the evidence from various radiation safety guidelines, how should an RO handle an emergency involving a radioactive spill in a laboratory? A. Ignore the spill if the radioactive material is in a controlled area. B. Immediately notify the authorities, contain the spill, and follow the facility's emergency procedures. C. Attempt to clean up the spill personally without notifying others. D. Evacuate the facility without performing any containment procedures. Answer. Correct answer. B. Immediately notify the authorities, contain the spill, and follow the facility's emergency procedures. Explanation: in the event of radioactive spill, the RO must immediately inform the relevant authorities and contain the spill to prevent further contamination. Following emergency procedures, including notifying emergency response teams and using appropriate containment methods, is critical to minimizing exposure and mitigating. Question 21. In the context of radiation protection, what is the purpose of performing a radiation survey after a radioactive source has been removed from a facility? A. To confirm that the area is free from radiation contamination. B. To ensure that all radiation detection equipment is functioning properly. C. To calibrate the radiation detection instruments. D. To measure the potential for future radiation leaks. Answer. Correct answer: A. To confirm that the area is free from radiation contamination. Explanation: after the removal of a radioactive source, it is essential to perform a radiation survey to ensure that no residual contamination remains in the area. This confirms that the area is safe for personnel and complies with radiation safety standards. Question 22. A facility has been using a radioactive material with a half-life of 10 years. If the material has been in use for 30 years, what fraction of the original activity remains? A. 1/8, B. 1/16, C. 1/4, D. 1/2. Answer. Correct answer: B. 1/16. Explanation: the decay formula is equals to 0x12 TT12 A0x21 T12 where Tt is the time elapsed and T12 T12 is the half-life. In this case, after 30 years, 3 half-lives, the fraction of original activity remaining is 1/2. 3 equals 1/821, 3 equals 8/1. Therefore, the remaining activity is 1/16 of the original. Question 23. Which of the following is considered the most effective method for reducing internal radiation exposure? A. Wearing personal protective equipment (PPE). B. Implementing good ventilation and using fume hoods. C. Regularly monitoring external radiation levels. D. Increasing the shielding around radioactive materials. Answer. Correct answer: B. Implementing good ventilation and using fume hoods. Explanation: internal radiation exposure occurs when radioactive materials are inhaled or ingested. The most effective way to reduce this risk is by using proper ventilation systems, such as fume hoods, to prevent the inhalation of radioactive particles. PPE and shielding primarily address external exposure. Question 24. What is the recommended action if an employee is found to have exceeded their occupational dose limit for the year? A. The employee should be reassigned to a non-radiation area until their dose is within safe limits. B. The employee should be given a larger dose the following year to balance the exposure. C. No action is necessary unless the dose exceeds the annual threshold by 50%. D. The employee should be suspended from radiation-related work permanently. Answer. Correct answer: A. The employee should be reassigned to a non-radiation area until their dose is within safe limits. Explanation: if an employee exceeds their occupational dose limit, they should be reassigned to a non-radiation area to prevent further exposure. The individual's health and safety are paramount, and no further radiation exposure should occur until the dose is within permissible limits. Question 25. Which of the following statements about radiation protection during medical procedures is correct? A. The use of lead aprons is optional for patients but mandatory for radiology staff. B. Fluoroscopy should be performed as quickly as possible to minimize exposure. C. Shielding is not necessary when working with diagnostic X-rays. D. The longer the exposure time, the lower the radiation dose. Answer. Correct answer: B. Fluoroscopy should be performed as quickly as possible to minimize exposure. Explanation: in medical imaging, fluoroscopy can result in prolonged exposure to radiation. Therefore, it is crucial to minimize exposure time while still ensuring the diagnostic quality of the procedure. Lead aprons are required for both patients and staff, and shielding is essential. Question 26. A researcher is using a radioactive material in a laboratory. To reduce the radiation dose received by the researcher, which of the following factors should be prioritized? A. Reducing the amount of time spent near the radioactive source. B. Decreasing the thickness of the shielding around the radioactive material. C. Increasing the radiation source intensity. D. Moving closer to the radioactive material to increase the intensity of the measurements. Answer. Correct answer A. Reducing the amount of time spent near the radioactive source. Explanation. To minimize radiation exposure, reducing the time spent near a radioactive source is one of the most effective strategies. According to the ALARA principle, time, distance, and shielding should be optimized to reduce exposure. Question 27. Which of the following radiation types is the least penetrating and is typically stopped by a sheet of paper? A. Beta particles. B. Gamma rays. C. Neutrons. D. Alpha particles. Answer. Correct answer. D. Alpha particles. Explanation. Alpha particles are large and highly charged, making them the least penetrating form of radiation. They can be stopped by a sheet of paper or even human skin. Beta particles and gamma rays are more penetrating and require more substantial shielding. Question 20. What is the role of the Radiation Safety Officer RSO in ensuring compliance with regulatory limits for radiation exposure? A. The RIO should be responsible for determining the radiation dose limits for employees. B. The RIO should monitor and ensure that radiation exposure stays below regulatory limits. C. The RIO should be responsible for deciding whether any radiation exposure is acceptable. D. The RIO is only responsible for ensuring the equipment is operating correctly. Answer. Correct answer. B. The RIO should monitor and ensure that radiation exposure stays below regulatory limits. Explanation. The RSO plays a key role in overseeing radiation safety programs, which includes ensuring that radiation exposure for all personnel remains below established regulatory limits. The RIO should not determine those limits, but should ensure compliance with them through monitoring and safety practices. Question 29. In radiation protection, which of the following is an example of an effective administrative control? A. Wearing personal protective equipment (PPE) at all times. B. Limiting access to radiation areas by restricting personnel entry. C. Using thicker shielding around radiation sources. D. Keeping radiation sources as far away from personnel as possible. Answer. Correct answer. B. Limiting access to radiation areas by restricting personnel entry. Explanation. Administrative controls, such as limiting access to radiation areas, are essential to protecting personnel from unnecessary exposure by controlling who enters radiation zones and when the potential for exposure is minimized. PPE and shielding are also critical but are considered engineering controls. Question 30. A laboratory is working with a radioisotope that emits both alpha and gamma radiation. Which of the following materials would be most effective at shielding the gamma radiation? A. A sheet of paper. B. A plastic container. C. A lead shield. D. A thin aluminum plate. Answer. Correct answer. C. A lead shield. Explanation. Gamma radiation is highly penetrating and requires dense materials such as lead for effective shielding, while paper can block alpha particles and aluminum can stop beta particles. Gamma rays require materials with a high atomic number and density like lead to effectively shield against them.